Thank you, Chair. Minister, I'd like to ask you about two different areas. One, the screening services, and thank you for the update, and the second is the contract with the private hospitals. On the screening services, obviously they had to be closed down. We screen about 3,000 women and men a day. So closing them for 3 months has meant that 170,000 screenings thereabouts haven't happened, and we all back the screening services. We know early detection saves lives, and unfortunately also therefore delayed detection can cost lives. Many doctors, Minister, believe that they can open now. Cervical screening, for example, in the 3 months that have passed, 70,000 women will not have been screened. GPs and scientists are contacting me and saying the GPs are ready, social distancing measures are in place, they can take tests now. The labs are saying that they can do the tests now. The colposcopists, the specialists are there saying we can take the referrals from the lab results now. So I'd like to ask you when we're going to have a date, because doctors are really anxious about this. I'll just read you out what one GP said to me this week. Quote, "We have a tentative date for opening of hairdressers and pubs, but not for cancer screening. It's alarming and extremely concerning." So I welcome your update today. I welcome that you're engaging with the screening services, but what the clinicians are asking for is a date. When are we going to have a date when they can get back to providing this life-saving service? The second question, Minister, is about the contract with the private hospitals. As you know, I was fully in favour of the initial decision, but not of the ongoing use of it. I don't think it worked well, and I welcome the decision to end the contract, and hopefully we will have some replacement capacity put in place for public patients, obviously. But I don't understand why it's being run through June. We're still going to pay over €115 million. The reduced capacity that is the result of this effort to try and do both at the same time, my understanding is will result in about 10,000 less surgeries happening under general anaesthetic, so serious surgery for public and private patients. It was also revealed at committee that no effort was made to ask the private hospitals if they would consider ending the contract sooner. So can I ask you, Minister, why was no effort made to end it sooner so that we could try and get patients the care they needed quicker? Thank you.
Thanks.
Next is
he's going to. Sorry, Chair. We'll do the 5 minutes with me if that's okay. Thank you.
So I'll stop at 10 minutes. Thanks to Deputy Donnelly. So just firstly, I mean, I want to be in a position to be really clear about. I want to be really clear about this. I want to be in a position. The Department of Health wants to be in a position. The HSE wants to be in a position. This Oireachtas wants to be in a position to recommence our population screening programmes as soon as possible. It's a collective priority for all of us. I am glad to inform you that the 4 programmes, there are obviously 4 parts to our screening service, will report on their final plans for restarting in the coming days. I had a very good meeting with the HSE CEO and Chief Clinical Officer Dr. Colm Henry yesterday, I believe. A very good meeting today with the Chief Executive of the National Screening Service as well. But I do have to emphasise, and I know you don't mean it like this, Deputy Donnelly, but when people say, you know, this can open and that can open, there is a complexity in relation to getting our screening services right. It has to be safe for patients, we know that. It has to be safe for staff, and it also has to have the confidence of people that they'll begin to come forward. Again, remember, this is often healthy people volunteering to come forward into our health service. Screening can often involve tests or examinations, which can present challenges for staff running these programmes in light of the need to comply with physical distancing measures. So there is a working group established. It's chaired by Dr. Caroline Mason, and I want to thank her for the work. So it is being led by a clinician, and it is reporting to the Chief Clinical Officer, Dr. Colm Henry. The working group is reviewing the individual programme plans for recommencement and developing a framework to support the safe restart of all 4 programmes. And just on the issue of, if you take cervical check, the example you gave me, there's kind of 3 parts to it. There's the sample takers, largely GPs and nurses. I accept that they're probably in a good place to go. There's making sure we have, from a colposcopy point of view, treatment pathways. And then there's the labs. And we just need to make sure each of those 3 parts are lined up so we can have a seamless recommencement. On the issue of private hospitals, I want to make sure that we use the time left to the end of this month to have a successor arrangement. I did explain in this House last week that there are already a number of services that have transferred nearly wholly from the public health service to the private health service, particularly in the space of cancer care, and I listed them last week. I want to make sure that we use that time available so that there isn't a cliff edge, so that we don't just have no agreement or a vacuum, and that's why we took the decision to use the period of time between now and the end of June to negotiate what I think will be a better and more fit for purpose deal.
Thank you, Minister.